Cynthia. I'm just going to go over how to do a breast self-exam so you can do this at home. You should be doing it monthly and then, reporting back to your practitioner if you find anything abnormal. So I'm going to have you take this pamphlet home so you can kind of use this as a guide. But basically, what you're going to want to do is you just want to stand in front of the mirror with the arms at your sides. You're going to check for size and symmetry of the breast and contour of the breast as well, and characteristics of the nipples, if they're inverted. And you're going to want to do this 5 to 7 days after your menstrual cycle has started. So a couple different positions. You're going to put your hands over your head. You're going to put them at your hips. You're going to lean forward. And all those positions use different muscle groups, and potentially it's bringing out any dimpling or retraction. So when you're in the lateral position, you're going to have your wrist on your forehead, and you're going to be lying down in a supine position, but your wrist on your forehead, and using your last 3 finger pads, you're going to go like in a vertical strip pattern, kind of down and up, down and up, down and up, and that's like kind of the best technique that they found over the years to detect any breast masses. And you want to make sure that you're getting into the talus fence, which is kind of up in this axilla area, because that's normally where any nodules are predominantly found. And then you're going to, on the medial side, you're going to have your hand on your shoulder or the neck area, and then you're going to do that same vertical strip pattern again. And then in your mind, you're going to divide your breast into 4 quadrants like a clock. And if you're, if you find something, say at like 2 o'clock or say 7 o'clock, you definitely want to mention that to your practitioner so they can know where to go first. And then you're going to palpate your nipple and check for any elasticity or thickening changes, because those 2 changes could indicate any breast cancer as well. Hi Cynthia, I'm Sheila. I'm just going to do an assessment on your abdominal and renal systems today. I see that you're in a good position. You have your knees bent and your head's in about a 35-degree angle. And your arms are by your sides, which helps loosen and relax the abdominal muscles, and you've used the laser room prior to the exam, which potentiates the best exam as well. So I'm just going to first start by observing and looking at your abdominal area. I don't see any pulsations, I don't see any peristalsis. I'm looking at your umbilical area, and I don't see any hernias. I don't see any scars from your previous surgeries as well. So now I'm just going to listen to all 4 quadrants and listen for vowel sounds using my diaphragm. And vowel sounds are present in all 4 quadrants. And now I'm just going to use the bell of my stethoscope to listen to some vascular sounds in the aortic, the renal, the iliac, and the femoral. Aortic, renal, iliac, and femoral. And I don't hear any bruits, which is indication that there's no signs of stenosis. So now I'm just going to do some light palpation, and I'm just going to feel for any nodules, masses, any tenderness. I don't see that you're grimacing, so is there any tenderness when I'm palpating? Very good. So I'm just going to do a deep palpation with 2 hands. I'm just going to palpate a little bit deeper, looking for any masses and nodules, and I don't see that you're grimacing, so is there any tenderness when I'm palpating? No. Good. Okay. And do that. Palpate for your liver. I'm just going to use the hooking techniques. I'm going to come underneath your rib cage, and I'm going to have you take a deep breath in and out, and the liver is non-palpable. I'm just going to feel for your spleen over here, and your spleen is non-palpable. And I'm just going to do some percussion on your abdomen. And it's tympanic throughout. So now I'm just going to percuss your liver to measure the diameter, and I'm just going to use my landmarks, the mid-clavicular line and mid-breast, and I'm just going to percuss down until I hear dullness. And right about there, I'm just going to mark that with some tape. And then I'm going to go the other way, so I'm going to percuss from the umbilical line, mid-clavicular, and percuss till I feel dullness. Right about here. And then I'm going to measure with the ruler in centimeters. And it's about 7 centimeters, which is within normal limits. It's usually between 8 and 12 centimeters, so your liver is not enlarged. Then I'm going to percuss for your spleen, and it should be between the 6th and the 10th rib. So I'm kind of going to put in this area here. And it's right about here, which is within normal limits between the 6th and 10th rib. I'm just going to do the bimanual exam to palpate the kidney. So I'm just coming underneath the small of your back and then underneath your rib cage here. And I'm taking a nice deep breath in and out. And the kidneys are palpable. And I don't feel any masses. I'm just going to use fist percussion to check for any costovertebral angle tenderness. So CVA tenderness is what it's abbreviated as. So just across here. And do you feel any tenderness?
No.
And on the other side?
No.
And no tenderness.